Welcome everyone to the VIA podcast. Today we are talking about hepatitis. World Hepatitis Day is observed on July 28th each year to raise awareness about hepatitis, promote prevention and treatment, and advocate for improved access to healthcare services. Today we are very lucky to have with us again Dr. Gary Harstein, VIA MEDICA's Chief Medical Officer, an experienced American physician specializing in anesthesiology, emergency medicine, and critical care. With over 20 years of expertise in hospital care, surgical procedures, and event management, he brings valuable skills to the table. He has extensive experience in disaster medicine and has served in numerous leadership roles. Dr. Gary's expertise in remote medicine and mass casualty incident planning contributes to the safety and well-being of communities. Welcome, Dr. Gary, and welcome back to the VIA podcast.
It is a great pleasure to be here again.
Excellent. So straight to the point. The first question being, what are the different types of hepatitis and how do they differ from one another?
Great question. Of course, I'm not surprised. In general, hepatitis means inflammation of the liver. All the hepatitis have in common the fact that the liver tissue becomes inflamed and damaged. In general, when we talk about hepatitis, we're almost always talking about infectious hepatitis. And when we're talking about infectious hepatitis, we are almost only ever talking about various viruses that cause these hepatitis inflammations. There are, however, other forms of hepatitis, including what we call iatrogenic hepatitis. And what that means is they are caused by treatments themselves. There are certain medicines that people take, the liver can react to with hepatitis. This is a side effect. It can be a grave side effect. And it's one of the reasons that whenever somebody comes in with hepatitis to the clinic, one of the first questions we ask is, are you taking any new medicines? The differences between the types of hepatitis, in addition to the cause, mainly have to do with the time course of the presentation, how long between, say, the infection and the presentation of symptoms. The second distinguishing factor is whether this is a hepatitis that can turn into a chronic form, that is to say, doesn't 100% go away, but persists for several months, several years, or even for the lifetime. And then the third and almost most important distinguishing factor among the different forms of hepatitis are whether the damage to the liver is such that it can lead to permanent scarring of the liver, which is known as cirrhosis.
So for non-medical people like us, how do we know if one has contracted hepatitis? What are the symptoms?
So that's another good question. The liver is a big organ. It has an incredibly important role in the body. But funny enough, the symptoms of hepatitis are generally fairly nonspecific. So the first thing generally that people would notice when they've got hepatitis is maybe some low-grade fever and just a general feeling of not being well. This can be accompanied by nausea and vomiting, generally not diarrhea. There may or may not be some pain in the right upper quadrant of the abdomen, usually not, to be honest. One of the things that people may find is that certain types of food cause them to really be nauseated. And people, for example, it's classic that people who love to eat meat find themselves a bit repulsed by the thought of eating meat. And if that happens to someone and continues for a couple of days, it may be worth investigating. Once hepatitis progresses, the most common symptom that people would notice is they begin to turn yellow. That's called jaundice. And jaundice is first noticed in the white of the eyes, which turn yellow, and then the skin can turn yellow. Not all hepatitis gives jaundice. Most hepatitis attacks or hepatitis infections go away before people become jaundiced. But certainly if jaundice ever appears in oneself or a loved one, that obviously needs to be worked up immediately.
How is it transmitted? So what precautions do we need to take to prevent contracting or spreading the virus?
Right. Obviously, if we're talking about transmission, we're talking about the contagious or infectious hepatitis forms. And we need to distinguish two forms. We need to distinguish hepatitis A, that's the name of the virus, it's the hepatitis A virus, which is transmitted much like most other diarrheal diseases by impure water or by what we call fecal oral contamination. So this is a water supply that has been contaminated by leakage of sewage into the water supply, the same as salmonella, cholera, and other diarrheal diseases. This is eating unwashed or poorly washed food, and this often happens when one travels to areas where the water supply is not clean. So obviously, taking all the usual traveler's precautions to make sure that you don't catch traveler's diarrhea will help to avoid hepatitis A. There is also a vaccine against hepatitis A, and I would highly recommend that for people who travel to endemic areas or areas where there are problems with the purity of the water supply. The other viral hepatitis B, C, D, E, and so on, they're all viral and they are all transmitted by blood and body fluids. So contaminated blood transfusions, contaminated endovascular material, needles, syringes, and so on. They are sexually transmitted. They are transmitted by contact infected patients' body fluids. And here, once again, hepatitis B and hepatitis C both have vaccines. And as healthcare workers, those of us who actually have patient contact, you must be vaccinated to get a license in the UAE, in many other countries. And even if it's not a requirement, common sense says you need to be vaccinated against hepatitis B and C. And then you also need to take all the usual precautions against body fluid contact.
Excellent. So we always say prevention is better than cure. However, if one does contract it, are there available treatment options and can it be cured completely?
Super questions, Tony. You're asking amazing questions, as usual. So hepatitis A is almost always relatively mild, relatively self-limited, never becomes chronic, almost never. So it kind of goes away by itself, doesn't need treatment except for avoiding ingesting anything that's kind of a little bit toxic for the liver. So it's highly recommended not to drink until your hepatitis goes away. Certain medicines you'd want to shy away from if you can. The hepatitis C has a specific treatment that can be successful in completely eradicating the virus. It is not always successful, and it is not a fun treatment. It's a treatment that is extremely debilitating on the body. It's relatively expensive. It's really, really a grueling thing to go through. And as you just said, it's obviously much better to not get hepatitis than to get it. The hepatitis C treatment can be completely effective in ridding the body of the virus. More often, it forestalls the progression to chronic hepatitis and cirrhosis and decreases the body's load of virus.
Right. Thank you for joining us today and generously sharing your knowledge. We greatly appreciate your time and insights. Everybody stay safe, and I hope that we do go for vaccinations. And if we can't, just know that we have medical providers that can assist you through that process. We are available 24/7 to help you. Dr. Gary, thanks for your time. Have a great day.